How many of you have heard of Dr. Robert Malone? He wanted me to skip his long list of credentials that I would have had trouble memorizing anyway, and just to let you know that he was the inventor of the mRNA technology that's in these vaccines. But because he's a true scientist, he recognized that the S-spike protein is actually dangerous, and he's questioned things. And he's been advocating for us. He's a government whistleblower, and he's been fighting very, very hard for us. So please give it up for Dr. Robert Malone.
All right, you guys are going to stop because I'm going to start crying if you keep going on like this. I don't have the fire. I'm amazed and overwhelmed by the passion we've seen and the truths that have been spoken. I'm not coming here with that. I'm coming here right there. I'm coming here as a outsider. And people from your community asked me to bring some of my friends here and to speak to you. What I'm trying to do is listen to you, but also to think, what can I do, what can we do to help make your lives better, to heal what the damage has been to your community and to your people. What can I do? What can we do to help you? Now, I think the one thing we can do is to give you information. I come from the school of give a man a fish, you feed him for a day. Teach him how to fish, you feed him for a lifetime. So what I'm trying to do is to give you folks the tools and information that allow you to think things through yourselves. This isn't, it may sound really scary, and we have been hammered with fear. I mean, everybody's spoken about it. The fear has just been overwhelming. It's been pushed on us day after day after day. Okay? No fear. We need to stop this. Okay? Now there's another key thing, and I was at a dinner last night with a smaller group because of course we couldn't be a larger group because of the 50-person mandate. And one of my new friends here from the islands, Tom Lewis, got up at one point and he gave this incredibly impassioned speech. And he said, you know what this is really about? It's about integrity. And what we're suffering from is lack of integrity. What we're suffering from is the failure of our public officials, the failure of our leaders in hospitals, the failure of our leaders as politicians to maintain personal integrity, to set the truth ahead of their personal interests and their financial interests. And we've heard direct testimony. I mean, this isn't, I'm not saying this is coming from your community and your community members sharing with you these stories. But there's more to this. We've never seen this. I constantly get the question of what is going on. It doesn't make sense. How is this all so coordinated? Okay? We are seeing an unprecedented campaign to silence physicians, to hunt physicians, to spread information, misinformation, propaganda, and use it to try to control you and to control the entire society. You can't deny it. It's in your face all the time. Now, the place that this all started for me was with this group called the Pono Coalition that reached out to me one day out of the blue. And it had some really impressive intellectual firepower coming from Hawaii. It had a pediatric cardiologist with deep depth in vascular inflammation who reported that he was seeing in his practice this damage to the hearts of the children that he was treating. His name's Kirk Milhound. He's a local pastor. And I also heard this gentleman that I hadn't run into before, but I should have, named Lauren Pang. Now, who is Lauren Pang? You know, why would I care about him? Well, I guess he's fourth generation Hawaiian. He was trained on the mainland. He's got an MD, an MPH, Masters in Public Health. He was in the Department of Defense for years, working at Walter Reed, among other places. He's had a lot of the same training I have in bioethics. And then he's worked here to support all of you for over 2 decades as your Maui public health officer. The man is deeply committed to bioethics and has a sophisticated, granular understanding of them and has fought for your community against Monsanto before. And then, so the Pono Coalition is founded, and I get distracted. I've got all these podcasts and travel all over the world and whatever. And then I hear about Lauren Pang being attacked by a state senator. And then I learned the state senator that has been attacking him is one that has ties historically to this company, Monsanto. Oh. And then I remember that Lauren Pang has led the charge against Monsanto in the past. And I find this state senator, and then I ask more questions. I hear, well, it appears that this state senator has some ties to a vaccine company called Pfizer. Okay? And yet this state senator is attacking this person that has committed his whole life to public health and bioethics and is deeply, deeply committed and rooted in your community. And then I knew when I was invited, I had to come here. I'm invited to places all over the world. But when I heard about my 2 friends, who are being attacked by people with no medical credentials, who are being attacked by the media mercilessly in this same pattern of attacks with the same script that I hear physicians being attacked all over the world. That's the thing. You may not see it, but what's happening to these 2 gentlemen, these 2 highly qualified physicians that are committed to your community. One of them is a pastor at a local church. He serves in the hospital. The other one is this multi-generational Hawaiian who is committed to public health and to serving you. A gentleman who is so soft-spoken, so humble. I mean, he embodies all the good, as far as I'm concerned, in your community. He's of you. And when I heard about this, I said, I have to do anything I can to help these people. So I'm here just to help them and to do whatever I can to help you. And I asked some of my friends, and a number of them, I was really grateful, were able to come here on short notice, like Richard Urso, Ryan Cole, and Steve Kirsch. So I'd like to say one little thing that Lauren Pang, if he was here, would tell you. And Lauren isn't here because he's being targeted. They're talking about taking away his license to practice medicine. They're talking about taking away his ability to help you. A man who has spent his entire life helping others. And for political reasons, they want to take away his ability to help you. Okay? One of the things that he would tell you, Lauren would tell you, is coercion to take experimental products is illegal. Okay? It is illegal. There was this event after World War II, we called it the Nuremberg Trials, okay? This is not legal. It is specifically prohibited in the Code of Federal Regulations. We call it the Common Rule. And for some reason, we now have a government that feels like and thinks that they don't have to obey the law. We're now in a position where the Health and Human Services believe that they are above the law. They don't have to follow their own policies and procedures. They don't have to follow federal law in terms of bioethics for humans that are written into federal law. Make no mistake, there are no licensed vaccines available in the United States, okay? They are all currently experimental products, which means that you have rights. You have rights anyhow, but for experimental medical products, think about it. They're asserting that they have the right to tell you that you will take something that is not yet approved, that has not yet had all the necessary clinical trials, that's not been proven to be safe. And that's just, that, I don't know what else to call it. It's lawless. So I'd like to hit 3 key things, and we're calling it the Maui Plan. Okay, the Maui Plan. Number 1, early treatment. You heard from Richard Urso what constitutes early treatment. You heard from Richard Urso how many different drugs are available for early treatment. You heard from Richard Urso that anti-inflammatories are effective. You heard from Richard Urso and Ryan Cole that this is a disease of your body responding to the virus, and it only happens in a tiny fraction, okay, of all of you. Remember, if you're not old and morbidly obese and have an immunodeficiency syndrome, your probability of having significant death and disease from this virus is a fraction of a fraction of a percent, okay? So, no fear. Early treatment. Physicians need to have the right to practice medicine. We're the ones that have been trained. The media is not trained to practice medicine. The politicians are not trained to practice medicine. The physicians have spent a crazy amount of time learning how to practice medicine, how to treat you. Let's let physicians practice medicine. Thank you very much. You want a case study and somebody that's being blocked from practicing medicine? It's Lauren Pang, okay? This has got to stop. Please help me stop the harassment of Kim Millhouse and Lauren Pang. This is not acceptable. Third point to the Maui Plan. Don't vaccinate our children. Why shouldn't you vaccinate our children? The risk to kids from this pandemic are about 0, pretty darn close. There's been something like 400 deaths in children since the beginning as identified by the CDC. Every single one of those was run to ground. Every single one of those was in children who had major pre-existing medical conditions. If your kids are healthy, they are not going to have this disease. They're not going to be hospitalized. They're not going to die. If they do, it's an extremely rare event, and they probably have a pre-existing condition. So let's stop the fear being put on our children.
Yes.
The fear is what's damaging our children. It's not the virus. I see a sign out there, this is a war on our children. I completely agree. This has to stop, okay? The risk to the children is essentially 0. The risk of the vaccine, I'm sorry, this is, I'm really sorry to say this, I'm a vaccinologist. This is what I do for a living. This is technology that I helped develop. I didn't build these vaccines. The risk of these vaccines in children is about 6 times higher than the risk of the disease is. Okay? Now, it's still small risk, but it's 6 times higher. That means if we vaccinate all the kids, we're going to see more kids die and have major damage to their hearts and other kinds of damage, like blood clots, than would have been damaged by the virus if they all got infected by the virus. Okay? Boys versus girls. Unfortunately, it's 3 times worse in the boys than it is in the girls. We're seeing young athletes. It's not just the clinical presentation of myocarditis and this heart damage. It's seeing things like their performance as young athletes gets compromised. This is why we have so many athletes the world over that don't want to take the jab, that are functioning at the top edge of their capabilities, the top edge of human performance. They don't want to take the jab because they can see clearly that their peers, their friends, and potentially them are going to have more difficulty competing. They're not necessarily going to have a heart attack and die, but there's high probability that they're going to have some damage and it's going to make it harder for them to compete. And the heart doesn't heal. Ryan Cole will tell you it's scars. Okay? And scars of the heart don't go away. Okay? So don't believe that's another part of the propaganda that's being pushed at you. Boys versus girls. Are they spreaders? Are they super spreaders? The data aren't showing that. Matter of fact, if there are super spreaders here, it's probably the vaccinated adults who are having less symptoms, going to the grocery store, going into their schools, going into the hospitals, going into state government. Whether they're vaxxed or not, the vaccines are not protecting them from infection against Delta, okay? And they do provide some protection from disease. They make it so they show less disease, which means they feel healthier, which means they're going to be walking around spreading virus. They manufacture just as much virus as anybody that's unvaxxed. So those are the inconvenient facts. And we all know this. You've all heard me talking about it. You've heard these other folks talking about it. And you all have this problem when you hear it. This doesn't make sense. These mandates don't make sense. Why are they doing them? I think that's a really good question that you guys ought to take to your state government. Why the heck are you doing stuff to us that makes no sense at all? Okay? So, in sum, speaking on this topic, I have children, I have grandchildren. I don't want to see them damaged by the virus. I don't want to see them come down with disease. And I know that those of you that are parents feel this dilemma. You're surrounded by all this information saying you have to protect your children by having them get vaccinated. And you have to vaccinate the children to protect the school teachers and the grandparents and the elders. And I think that's a noble idea, okay? I think we got to give people credit for wanting to do the right thing for their community. Unfortunately, taking the vaccine won't get you there. So it's a great idea. We should all be concerned about our community, but they're asking us to do stuff that won't get us to the solution. So, in sum, please help Lauren. Lauren Pang is hurting. He is under threat from his whole career being destroyed by politicians and the media, okay? Please help him. Help me to help him. And I guess I want to close on, let's go Brandon, huh?